Hey everyone, thank you for coming to our virtual event. I am Dr. Gentry and this is our nurse practitioner Jessica.
Hi everyone.
We are the injectors at Rejuvenated Medical Spa, and today we're going to talk to you about some exciting products from Revance, RHA filler, and the brand new wrinkle relaxer Daxxify. So Jessica, we're getting a lot of questions, but what exactly is Daxxify?
Daxxify is a new neurotoxin made in California. It's similar to Botox and Dysport, and it's helped to reduce wrinkles.
Okay.
So it's similar to Botox and Dysport, but how does it differ?
So that's a really good question because Daxxify actually uses a novel peptide that is positively charged to the active ingredient. So the way all of the neuromodulators work is they go into the nerve cell and block the release of acetylcholine, which causes muscle contraction. So when the muscle contracts, it causes a wrinkle, but the neuromodulators stop that. So without that particular muscle contraction, the wrinkle stops forming and it goes away over time. So the nerve cell is actually negatively charged on the surface, and so the positively charged peptide from Daxxify attracts to the edge of the nerve cell and keeps it there longer, so more of it is taken up into the nerve cell and therefore it lasts longer.
I like that.
So what can Daxxify treat?
Like all the other neurotoxins, you can treat your forehead, your 11s, your crow's feet. I like to put it above the lips for a nice lip flip or reducing the smoker lines.
Okay.
It's great for TMJ if you have any muscle tension there. You can also work in the lower face, your neck. So it's been used in pretty much every other area like other neurotoxins out there.
So pretty much anywhere you put Botox, you could put Daxxify.
Correct.
Okay, so what are these frown lines that people talk about? Some people call them 11s, some people call them frown lines. But people get them whenever they scowl or when they're concentrating on a computer. Maybe you're mad at your kids.
Yeah, so it's called the 11s because you make those 11 look on your frown line.
Okay. So we talked about using Daxxify in different areas of the face, but who's a good candidate for Daxxify?
Adults who are wanting to get rid of wrinkles or prevent wrinkles, who are not nursing or pregnant and have neurological diseases, are a good candidate.
Great, so almost everyone.
Yeah. So everyone's talking about the longevity of Daxxify. Can you explain to us?
Yeah, so the product is really cool. It kicks in very, very rapidly from my experience within just a few days with your maximum effect at 1 to 2 weeks. But in the studies for frown lines, so the 11s that we were talking about earlier, over 50% of the patients got over 6 months duration, and a few people had 8 to 9 months duration, which is pretty amazing.
Yeah.
Considering the other neuromodulators typically last 3 to 4 months. And so the hope is that it lasts twice as long as the competitors.
I like the sound of that.
Me too. So now let's talk about RHA fillers. There's 4 different ones, right?
Yeah, so in the RHA collection, there's 4 different ones. After a consultation, Dr. Gentry and I can determine which one will fit best for our patient's plan.
So we love to do consultations on everyone because each face is very individual and we want to come up with a customized treatment plan for your natural but refreshed results.
How does RHA differ from all the other fillers?
So RHA is a little bit different because they're trying to more closely mimic the HA or the hyaluronic acid that's naturally in your skin. And their claim is that they're better for dynamic wrinkles. And so the filler does better with facial movements and appears more natural. I specifically like RHA fillers because I feel like I can inject them a little bit more superficially than some of the other brands.
Nice.
So each of these RHA fillers is a little bit different. So Jessica and I are going to talk about how we both like to use them. And remember that each injector has their own style and their own preferences. And so we're just talking about how we specifically use these.
Redensity is actually one of my favorites for treating the tear troughs, which is under your eyes. It's also good for treating perioral lines, or if you have really thin lips that need a little bit of hydration, Redensity is good for you. RHA2 is also one of my favorites to put in lips.
So I do use RHA2 for lips a lot, and I do like Redensity for tear troughs. If someone really wants a lot of plump for their lips, I will sometimes use RHA3.
Same with me.
I also use this for nasolabial folds right through here, or sometimes the marionette lines. And then RHA4 is the most robust of the filler line, and I use it more for chin, jaw, cheeks, somewhere where you want a little more oomph.
Yeah, I like it.
Hey everyone, Dr. Gentry at Rejuvenated Medical Spa, and today we have our beautiful model and we are going to demonstrate some filler techniques and filler results. We'll be using the RHA line of filler, which is 4 different fillers ranging from a thinner up to a more robust filler depending on where we're going to put it. And we're going to make some fantastic but natural appearing changes because that's what our patient wants. And it's really all about meeting our patient's goals and expectations with realistic results. Okay, so now we're going to do our consult process. And this takes a little while to develop, but once you've done it a million times like we have, you get a little bit better at it. And so most of the time when people do filler the first time, they're looking at cheeks is typically the first place they start, or lips. Our model today does not want to do lips, and so we're going to be focusing on cheeks and mid-face, as well as this nasolabial fold. So the nasolabial fold is this fold that comes from the nose all the way down towards the mouth. And so this is a real common place to lose volume. And then I'm going to put just a little bit of chin filler here just to give her a little bit more of a chin projection for profile balance. So most patients, when they look at cheeks, they automatically think the outside or the lateral part of the cheek. And we are going to do that to accentuate her cheekbones a bit. But a more common place that people don't think about is actually the anterior or the medial cheek here. As we age, we lose collagen, we lose elastin, and we lose fat from the fat pads in our cheeks, and it becomes more deflated. And so what happens, I'm just going to tilt you down just a shade, you start getting a little bit of loss in volume right here, and this volume loss creates a concave surface. And that concave surface allows a shadow to be shown, and it makes you look tired or older, versus if you think about a young child or a very young person that has a convex surface, that convex surface reflects light and makes you look more bright and youthful. So we're going to correct a little bit of a volume deficit right here. We're going to accentuate her cheekbones here. We're going to fill in just a little bit of this piriform falsa and this nasolabial fold, and then just do a little bit of chin. She has nice lips at baseline. I would consider plumping her lips just a shade, not to make them bigger, but just to sort of hydrate them with a lower a lower G' RHA filler, just to give her those lips that she had 10 years ago, not to give somebody else's lips. But again, this is all about realistically meeting your patient's expectations and goals and making things look very, very natural, but refreshed. Okay, so we're done with filler today, and just for those of you that are always wondering, like, oh, I don't want to look overdone, I don't want more than 2 syringes, we actually put 6 syringes in her face today, and I think it looks very, very natural. Before we did the video, we talked about her desires, and she said that she did not want to look done or fake at all. She wanted to look very, very natural, she wanted to look refreshed, and so we were able to accentuate her cheekbone, fill in this part of the cheek that's lost volume, make that a little bit more rounded. Work on this nasolabial fold and this piriform fossa here, as well as the pregial sulcus and the chin. So a nice balanced but refreshed and natural appearing result. Again, with 6 syringes, And so you have to remember that one syringe is about the size of a blueberry. At Rejuvenated Medical Spa, we will never make you look fake or overdone. Okay, so now we're going to finish up with doing a little bit of Daxxify. And as you can recall from earlier in the video, Daxxify has the same mechanism of action as Botox, Dysport, Xeomin, and Jeuveau. But what they've done is they've attached a positively charged peptide to the active ingredient so that it sticks to that nerve cell and more of it gets taken up and therefore has a stronger duration of action. Because over 50% of patients that were treated here in the glabella had over 6 months duration of reducing those lines. So here we go, treating her glabella, or some people call them the 11s.